What if I told you we're on the verge of a whole new world in treating feline diabetes? And I'm not just talking about managing it, but actually getting to the root cause. I know big claims, right? But that's the kind of excitement brewing around this new class of drugs called SGLT2 inhibitors.
It's true. We're talking about a potential paradigm shift. For years, we've relied on insulin for feline diabetes, much like in humans with type 2. We've tried other oral medications, but honestly, the results in cats haven't been great. Until now, that is.
That's where our deep dive comes in. We're going beyond the headlines to give you the full picture of SGLT2 inhibitors based on the latest research presented by Dr. Thomas Schermerhorn. We'll break down what they are, how they work, and what kind of impact they could have on how we approach feline diabetes.
And trust me, the potential here is huge.
Okay, so SGLT2 inhibitors. Big words, even bigger implications. Before we get ahead of ourselves, can you give us the breakdown? Imagine you're explaining this at a, I don't know, cat cafe to someone who just really loves their cat and wants the best for them.
I like that image. Okay, so picture this. Your cat's body is constantly adjusting its blood sugar levels, right? It's like a balancing act. Now, insulin is like the entry control, managing how much sugar or glucose gets into the bloodstream. But what if there's a problem with the exit? That's where SGLT2 comes in.
SGLT2 being the bouncer who's a little too good at their job.
Exactly. SGLT2 is a protein in the kidneys that's a bit overzealous about reabsorbing glucose back into the bloodstream, even when there's already enough SGLT2 inhibitors come in and tell those bouncers to relax a little, letting some of that excess glucose exit through, well,
The kitty litter box comes into play. So less glucose being stubbornly reabsorbed, more of it being, shall we say, politely shown the door.
You got it. And here's where it gets really interesting. This whole process is independent of insulin. That means these drugs can work even if the cat isn't producing enough insulin on its own.
Now we're talking. You mentioned Dr. Schermerhorn highlighted two specific SGLT2 inhibitors, Bexacat and Synvelgo. What makes them so special?
Well, for one, they're the first of their kind to get FDA approval specifically for use in cats. That in itself is huge. Bexacat uses the drug bexagliflozin, while Synvelgo uses velagliflozin. They're both highly selective in targeting SGLT2 in the kidneys with minimal impact on other similar proteins in the body, like SGLT1, which is important for glucose absorption in the intestines.
So less risk of unintended side effects. That's always good news, especially when we're talking about our furry family members. But what do these drugs actually mean for cats living with diabetes? Are we talking real, tangible results here?
We are. And the results we're seeing are encouraging, to say the least. We're talking about nearly 90% of cats showing significant improvements in their blood glucose levels and a reduction in those classic diabetes symptoms. Always thirsty, always peeing, always hungry.
Okay, those are some numbers cat owners and their vets want to hear. But before we dive into the specifics of those results, let's take a pause and clarify something for our listeners. You mentioned these drugs are currently approved for newly diagnosed insulin-naive cats. Can you unpack that a bit?
Absolutely. Newly diagnosed is fairly self-explanatory. It refers to cats who have recently been diagnosed with diabetes. Insulin naive means they haven't yet started insulin therapy. This is an important distinction because
even with these promising new drugs, the cat's own insulin production is still super important.
Exactly. It all comes down to how glucose actually gets used by the body. Think of it like this. SGLT2 inhibitors are like clearing out a traffic jam of glucose in the bloodstream. But you still need those little delivery trucks, which is what insulin is like, to transport that glucose into the cells where it's actually needed for energy.
So it's not as simple as just flushing out the excess glucose we need to make sure the body can actually use what's there.
Precisely. That's why these drugs are currently targeted towards newly diagnosed cats who may still have some level of their own insulin production going on.
Okay, that makes a lot of sense. Now let's address the elephant in the room side effects. No medication is perfect, and whenever we're talking about new treatments, especially in our feline friends, we want to be aware of any potential risks. So what's the deal with SGLT2 inhibitors? What should cat owners be keeping an eye out for?
Well, the good news is that the most common side effects we're seeing are pretty manageable, mostly gastrointestinal stuff.
So we're talking upset tummy, maybe some vomiting or diarrhea.
Cats can be a bit sensitive, we all know that, so it's not entirely surprising. The good news is these effects are usually mild and often clear up on their own or with some simple supportive care. And because these newer SGLT2 inhibitors are so targeted in their action, these tummy troubles are even less common compared to older versions of the drugs.
That's reassuring to hear. But what about more serious complications? Anything cat owners and vets should be particularly aware of?
There's one in particular that Dr. Schermerhorn emphasized, and it's a bit tricky: diabetic ketoacidosis, or DKA, and its sneaky cousin euglycemic DKA, or EDKA.
A DKA. That sounds a bit more serious than an upset stomach.
It can be, yes. DKA happens when the body can't use glucose for energy properly, so it starts breaking down fat instead. This process produces ketones, which are acidic, and that can build up in the bloodstream, leading to all sorts of problems.
And here's where that whole insulin is still crucial thing comes back into play, right?
Yeah.
Because even if you're clearing out excess glucose with SGLT2 inhibitors without enough insulin to help the body use it, you run the risk of the body going into fat-burning overdrive.
You're catching on quickly. Now, here's the really tricky part with SGLT2 inhibitors. Remember, they work by increasing glucose excretion in the urine. This can actually mask the typical signs of DKA, like very high blood glucose levels. That's where euglycemic DKA comes in. A cat might have dangerously high ketones, but their blood glucose readings might seem normal.
So it's like a silent alarm going off, and you might miss the warning signs if you're not careful.
Exactly. That's why regular monitoring for ketones is so important, especially in those first few weeks after starting an SGLT2 inhibitor. We can't just rely on blood glucose readings alone.
Got it. Ketone checks are key. Now, I know there have been some whispers about a potential link between SGLT2 inhibitors and pancreatitis in cats. Anything to be concerned about there?
That's a great question, and it's something that researchers are still looking into. There were some cases of pancreatitis reported in the clinical trials for both Bexacat and Sunvelgo, but those studies weren't specifically designed to evaluate pancreatitis. It's a bit of a chicken or egg situation at this point, making it hard to say for sure whether the drugs themselves were the cause.
So more research is needed to know for sure.
Exactly. But as a precaution, the current recommendation is to rule out any existing pancreatitis before starting a cat on an SGLT2 inhibitor. And if a cat does happen to develop pancreatitis while on the medication, the usual course of action is to discontinue the SGLT2 inhibitor and switch to insulin therapy.
It sounds like, as with any new medication, a cautious and informed approach is always best. Working closely with your vet monitoring for any changes, that sort of thing.
Absolutely. And this is where Dr. Schermerhorn's insights into the specifics of monitoring become really valuable.
Perfect timing. You know what time? It is time to talk about what this careful monitoring actually looks like in practice. But first, a quick word from our sponsors. Don't go anywhere. We'll be right back to unpack Dr. Schermerhorn's recommendations. And we're back, ready to dive into the how-to of monitoring with SGLT2 inhibitors.
Absolutely. This is where the rubber meets the road, right?
Exactly. So Dr. Schermerhorn gave some pretty specific guidelines for monitoring cats on these new meds. What stuck out to you?
Well, he really emphasized that those first 8 weeks are key. Those initial 2 months are all about close observation and making sure things are moving in the right direction.
Okay, so a critical period for sure. What does that look like in practical terms for cat owners? Are we talking daily vet visits?
Not quite daily, thankfully, but it is a bit more frequent than a typical checkup schedule. Dr. Schermerhorn recommends a recheck exam and ketone assessment just a few days after starting the medication. Then another checkup at the 1-week mark, again with the ketone assessment.
So lots of close monitoring early on, making sure everything is running smoothly before things progress.
Got it.
And assuming those first 2 weeks go well, what's next?
At the 2-week mark, it's another ketone check. Then, at both the 4 and 8-week marks, a more comprehensive checkup is recommended. That includes the ketone assessments, of course, but also a glycated protein test, either fructosamine or HbA1c.
Glycated protein tests. Those always sound a little intimidating. Can you break those down for our listeners who might not be familiar?
Sure. Basically, these tests give us a bigger picture view of how well the blood sugar has been controlled over a longer period. It's not just a snapshot in time like a regular blood glucose reading. It's more like seeing the average blood sugar levels over the past few weeks.
Ah, so it's like getting a report card on how well the treatment plan is working overall.
Yeah,
Makes sense.
exactly.
Okay, so after that initial 2-month mark, it sounds like things settle into a more, I guess, routine schedule of vet visits and checkups, but with a continued emphasis on those ketone checks.
Precisely. And anytime you notice any changes in your cat's behavior or health, increased thirst, lethargy, anything that seems off, always err on the side of caution and call your vet. Don't wait for that scheduled checkup.
Couldn't agree more. Now, before we wrap things up, I want to circle back to something we touched on earlier. This idea of SGLT2 inhibitors ushering in a whole new era in how we think about feline diabetes. What has you most excited about the long-term potential here?
Oh, that's a great question. Honestly, there's so much to be hopeful for. One thing that really stands out is the potential for remission, especially in these newly diagnosed cats.
Now, when we say remission or we're talking a cure, the diabetes just vanishes.
It's not quite as simple as that, but it's close. Think of it like this. Feline diabetes is often triggered by underlying insulin resistance. By addressing that resistance early on, maybe with SGLT2 inhibitors as part of a comprehensive treatment plan, we might be able to hit the reset button on the body's metabolic balance. Give the pancreas a chance to bounce back, so to speak.
So instead of just managing a chronic disease, we might be talking about actually reversing it in some cases. That's amazing.
It really is an exciting prospect. And beyond remission, there's also the potential for these drugs to improve long-term health outcomes overall. Remember those added benefits we talked about? The potential for weight loss, better insulin sensitivity, maybe even protection for the kidneys and heart. These are all avenues that deserve further research, and they hold so much promise for the future of feline diabetes care.
It sounds like we're on the brink of a real turning point, where feline diabetes becomes less about lifelong management and more about early intervention, potential reversal, and a focus on overall metabolic well-being. That's a future I think every cat lover can get behind.
Definitely. It's a good time to be a cat person.
It really is. And for our listeners, you've now got the inside scoop on one of the most exciting developments in feline diabetes treatment. Remember, knowledge is power. The more you know, the better equipped you are to have informed conversations with your vet and advocate for your feline friend.
Couldn't have said it better myself.
That's all the time we have for today's deep dive into the world of SGLT2 inhibitors and the future of feline diabetes care. Be sure to subscribe and tune in next week for another deep dive into a topic that's sure to get those whiskers twitching. Until then, keep those curious minds engaged and those furry companions happy.